What is up, sapiosexuals? Thank you for turning on Sex Solutions with Dr. Sonjia. So the sex situation we're getting into today is all about the sex problems in Miami. Seriously, we know Miami is the sexiest city in America, but we also have more sex problems than almost anywhere else in America. Miami has led the nation in new cases of HIV for so many years. And in terms of sexually transmitted diseases, Miami is the top 4 state in the nation. Out of control, people. And it's not just sexually transmitted diseases and HIV. Miami also is one of the leading states in America in terms of erectile dysfunction. What? All these sex problems and men can't even keep it up or get it up? Well, we're gonna talk about it and break it down and figure out what are the right solutions to these problems. And I am so excited to have Dr. Olveen Carrasquillo with me here today. He is a professor and a clinician at the University of Miami. And you know what? I heard he knows a lot about sex. Thank you so much for being with us, Dr. Carrasquillo.
Thank you, Dr. Kenya. Always a pleasure to be here with you, but I do think this is a critically important topic. Sexually transmitted infections or sexually transmitted diseases, which we call STDs, it's certainly a major problem in our community, and I'm glad we're bringing greater public awareness on this serious issue.
Absolutely. And I think that really is the key that we want to talk about is awareness, because I think awareness, is that why people do have so many sex problems here, do you think? Do you think that it's just people don't really know that there are ways to avoid them beyond condoms?
Yeah. I mean, I do think that letting people know about this is an important thing. But as you noted, Miami's a very fun city, and there's many things that many people here in Miami do that put them at high risk for these infections. So it's important that we let everyone know how we can prevent these.
Okay, so you brought up a really important point. Miami is a super sexy place. And it's like, you know, we got professors of medicine out there looking like me. So imagine if you didn't go to school, how good you must look, right? And I do think that our proximity to the Caribbean, like people think that they're coming here to be on vacation. I think that when people go on vacation, they do get a little bit looser, right? I remember I did a study once in the Caribbean where I looked at the number of condoms that were on the beach. And guess what? I found none. I found no condoms on the beach. And when I looked at the STD statistics, it wasn't that they didn't have sexually transmitted diseases. They did, but they weren't protecting themselves, the people who were coming on vacation. So I actually thought it'd be a really good intervention for like flight attendants to be like, hey, on your way out, when you're going to somewhere tropical like Miami or one of the islands, like, here's a bag of condoms. I mean, is that what we really need to do in Miami to resolve our issues?
Well, certainly. I think condoms are certainly an important part of the prevention, and I'm all for trying to give out as many condoms as possible in as many venues, condom distribution. Many of our public health agencies have done this traditionally, so I think that's important. But people got to know about the risk factors for this and how to, protect themselves. And it's not only about giving out the condoms, but also how to use a condom appropriately. There's many videos online that teach this. You'd be surprised how many young people don't know some of those simple basics that we take for granted.
You're absolutely correct. And we have been approached, our street-based teams have been approached to do condom demonstrations. So we bring the models down and we show people how to put on condoms. And I think the statistics are like over 90% of people don't use condoms correctly, consistently. So they might use them consistently, but they don't always put them on correctly all the time. So like maybe when they're completely sober with their wife, they use a condom. Maybe they come down to Miami and they're on vacation and they get a few drinks in them and they think that they're putting the condom on correctly, but things happen.
Yeah, it's sad. So, we tell people there are many ways you can learn how to use proper condom use, and that's appropriate. But then we urge people of all the other precautions, right? I mean, we still joke about abstinence, who can be abstinent, but, we have to let people know that that is the 100% guaranteed way. Being in a monogamous relationship is really important. Monogamy, and again, you're going to talk about all the other problems that are a threat to monogamy, but I think that's also really important infection. And as much as possible, try to avoid unprotected sex. Try to avoid unprotected sex. We are a big university town here. We have a lot of universities, a lot of young people. They think they're young and invincible. They walk around with symptoms. They don't even know they have the disease. They gung-ho. They had unprotected intercourse. Their partner got sick, and they come see us.
Absolutely. And what you said, awareness about what you can do to prevent STIs in the first place. For example, if you do have a friend who engages in unprotected sex regularly, there is a medication that they can take to prevent themselves from ever contracting HIV, isn't there?
Yep. We have prophylaxis that you could either take, one, after you've been exposed to dramatically decrease your chances of getting HIV. But those that are having very frequent unprotected intercourse, we also recommend take medicines to prevent you from getting HIV. So there's two really important strategies. And now we have other strategies, but some infections, but none of these are 100%. So people have to understand that.
Right, but I do live in South Beach, and I know a lot of my friends are guys who identify as gay, and all of them tell me they are on PrEP, pre-exposure prophylaxis, and they take this pill every single day, and then they are able to engage in unprotected intercourse, and they do not contract HIV. And PrEP has some really good statistics in terms of efficacy, right?
Yeah, no, the data is great, but what I tell people, it's not only about HIV, there's many other diseases out there that you have to take, you're taking a risk. There's herpes, there's gonorrhea, there's chlamydia, the list goes on, syphilis. So, it's great people are doing this to prevent HIV, but you're still putting yourself at risk for many other conditions. But I'm glad at least they're using PrEP rather than nothing.
Right, and we know there's a PrEP mobile clinic in Miami that goes around and does distribute PrEP for free. They give you all of the clinical testing before to make sure that you're eligible and that it wouldn't harm your body. And then they're able to prescribe PrEP and actually offer follow-up right at your convenience in a community setting, so you don't even have to come to a clinic. So that is very, very, very cool. And then, not just for HIV, there's doxypep for other STDs, other sexually transmitted diseases. And is that a medication that you can take after you've been exposed to the disease?
Yeah, so it's, if you look on doxycycline, you take a pill, 200 milligrams, after you've had unprotected sex to dramatically decrease your chance of getting chlamydia. It is one strategy that people use, and so if you do have unprotected sex, please see your doctor. Go the next day to your doctor. There's a lot of other options for HIV, for gonorrhea. Please see a doctor. Please talk to them. But again, it's only part of it because there's many other conditions that you're still at risk for from having unprotected sex. Absolutely.
And when it comes to preventing it after exposure, always remember, if you're worried about HIV, if you had unprotected intercourse, or maybe you used a needle and you don't know someone's status, you can always take PEP, which is post-exposure prophylaxis, and that can be taken up to 3 days, 72 hours after you've been at risk, and that can prevent you from contracting HIV. So what Dr. Carrasquillo said, if you put yourself at risk, go see your doctor the next day. For breakfast, you're at the clinic, okay? Stay tuned. We're gonna talk about protecting yourself from Miami sex problems before you take that next flight down. We'll be right back with Sex Solutions with Dr. Sonjia.
Filled with dreams, talent, love. At the Children's Trust, we are dedicated to nurturing the potential of every child and family with hundreds of trust-funded programs. Find a program at thechildrenstrust.org
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman and Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman and Dover Law Firm, youraccidentattorneys.com.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
With culture.
Welcome back to Sex Solutions with Dr. Sonjia. So the sex situation we're diving into today is all about Miami's sex problems. We have so many sexually transmitted diseases. We're one of the top states in the nation, and the same for HIV. Every year we are bursting through at the top of the statistics, and we're with Dr. Carrasquillo, who is a professor and clinician at the University of Miami, and we are diving into it. We were just talking about some of the ways that you can prevent sexually transmitted diseases before they even occur. But there are some diseases like herpes that there is no way to really prevent it, right?
Yeah, unfortunately, there are some that you can prevent, and we didn't even talk about the vaccines. People don't think of hepatitis B sexually transmitted.
Right.
There's vaccines for that. Human papillomavirus causes cervical cancer and oral cancer. Young kids, young teenagers should get vaccinated against that. But then there's other stuff like herpes, that's still there. Type 1, type 2. People think of as genital, but it can also be oral. And that's the kind of stuff today, we have no good treatments. There's some medicines when people have it to decrease your flares, but there's really no good way. So that's why I keep telling people, there's things you can do, but at the end of the day, protection is the most important. Abstinence, monogamy, and if not, protection. That's what I tell people.
Absolutely. And you brought up a really good point with the HPV vaccine, because when I was growing up, the HPV vaccine wasn't available. It wasn't an option. And I think when I was in school, it was estimated that everybody who's 26 years old who's ever had sex has now been exposed to HPV. So with HPV, it's like hopefully your body clears it out on its own. But if it doesn't, it could turn into cervical cancer.
Correct.
And not just cervical cancer in men. I mean, it can lead to erectile cancer in both genders. It can lead to anal cancer. And so, yes, exactly. Mouth and throat cancer, or HPV can turn into head and neck cancer. And the issue with head and neck cancer is it's only like 40 or 60% curable. So that means that's like a 40% death rate, right? And that comes from oral sex. So that's how you would contract HPV of the throat. And there's no test, right? There's no assay.
There's research going on. People are trying to do about oral swabs and things, and they're good for helping detect HPV. But again, don't get into that. Get vaccinated. Avoid the whole thing. If you have a young child, above age, a young teenager, please talk to your doctor. If they haven't been vaccinated, they need to be vaccinated. Now, even young adults in the early 20s would get vaccinated. Please do it, and don't get into the whole, oh my God, did I get HPV? Get the vaccine, please.
Absolutely. And, my son is a middle school child. He has been vaccinated. And for those who are older than 26, a couple of years ago, the HPV vaccine was actually approved for adults up to age 45. So you can get vaccinated up to age 45. Talk to your provider about it, because it prevents over 90% of cancers of the reproductive organs that we were just discussing. So it's a really important vaccine, along with the hepatitis B as well. That's another one that you can absolutely prevent through vaccination.
Yeah, so many kids are vaccinated. People from other countries, they may not have been vaccinated, or sometimes parents just didn't know and it wasn't given. We can test to see if you've been vaccinated, and if you haven't been vaccinated, we will give you the hepatitis B vaccine. That's one not many people think about, but it can cause liver cancer, so very important.
Absolutely, absolutely. And I know the statistics from a couple of years ago, it was estimated that about 1 in 4 adults has herpes. Now remember, whether it's on your mouth or in your genitals, it can be transmitted either way. So if you like someone, you need to know what the purpose of your iPhone camera is, right? Before you go down with the full light. That's what I tell everybody. Because at least you should see what you're getting yourself into, right? So you want to go down and pleasure someone, you don't want to come up with a new problem you weren't expecting.
And sometimes you don't even have lesions and you can still spread it. So even people, oh, I checked and there was nothing there. No, you can't check to make sure that's not a right way to determine whether somebody has an infection or not. So that's still, I still say, please protect yourselves.
Absolutely. Okay, now we've talked a lot about STDs and STIs. I want to get into the other big sex problem going on in Miami. Erectile dysfunction. Some of the highest rates are right here in Miami. First of all, I got to ask you, Dr. Carrasquillo, why do you think erectile dysfunction rates are so high in Miami? Just a wild guess.
We do see a lot of men with the problem. Some of it is, psychological. But as doctors, there's also a lot of medical causes of this. We have high rates of diabetes and other vascular disease, and those are major risk factors also for erectile dysfunction. But please, talk to your doctors about it. There's lots of good treatments, not just pills. There's many other things people can do, but we do have really good treatments. And some men, you've saved their marriage when you put them on the appropriate treatment for them. So it's really important. Sometimes those doctors are bad. We don't ask people about it. Please write it down and ask your doctor because there are solutions.
That's funny. You said it can save a marriage if you get him treatment. I'm thinking about a lot of the women who I've worked with who are, I actually am wondering, would it be appropriate for the wife to talk to the doctor, like call him ahead of time and say, don't prescribe him any medication because I don't want to have sex with him anymore? Like, is that allowed at all?
We treat the patient.
Okay.
If a man thinks that it's a problem for him, we try to help him with his health problems.
So I think one of the biggest contributors to erectile dysfunction in Miami has a little something to do with, all the 70-year-old men trying to date the 20-year-old women. I don't know. What do you think, Dr. Carrasquillo?
Look, I am not going to comment on the morality, but if you're a 70-year-old guy that wants to date a 20-year-old woman, and you are having erectile dysfunction, we can help. That's what I want to say for that. Again, everyone talks about the pills, but there's also treatments. We have tremendous urologists that take care of many men in that situation, and so there are options. What I would say is please don't keep it private. Please don't keep it to yourself. Please talk to your doctor about it, and they can help you.
Okay, so do doctors ever recommend anything like natural? One of the things I really know works is like a pomegranate and watermelon shake. It like functions like natural Viagra. And I've actually made that smoothie for someone and seen the effects in real life. So do doctors ever talk about some of the natural ways?
We as doctors, we're trained in what's called evidence-based medicine, things that have been proven through like medical research studies. But the truth is, for many people, some of these natural things help. And when people ask me about it, if it's not something harmful or dangerous and it works for you, all the power to you and do it. So if somebody came to me and said, a friend made me a pomegranate shake and it helps erectile dysfunction, I'm very happy with the effects it's having, I'm like, good, all power to you. So I do support that, but no, doctors may not be the best source of information about all these other things that are not approved. List. some doctors sometimes don't forget, or, you'll have the nurse quickly ask, any sexual problems? No, and that's not, you're supposed to ask about all these things. Are you having unprotected intercourse? We forget sometimes. So when you're going to see your doctor for this annual exam, write a list of all these things, highlight it to them, because sometimes we're not the best at asking or getting this history. And so it's really important that you let them know, because yes, there's a lot of things we could do to prevent STDs, that the doctor can work with you. If you do have erectile dysfunction, there's other things. We primary care doctors, we know a little bit. We prescribe pills and other things, but there's other treatments, and we'll refer you to urologists as well if that's needed. So yes, please talk to your doctor. Don't expect us to ask the question. Please bring it, write it down before you visit, and let us know.
So the point is, doctors do have information and they want you to ask about it. I mean, they're not broke. They're making a lot of money. Make them work, y'all. Get your sex education, not just your sex education. Get your sexual health interventions to keep you healthy and satisfied. Stay tuned. We'll be right back with Sex Solutions with Dr. Sonjia.
54-MORE.
That's 866-954-6673. Demesman and Dover Law Firm, youraccidentattorneys.com.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
With culture.
Welcome back to Sex Solutions with Dr. Sonjia. So fun having this conversation with Dr. Carrasquillo about how you can avoid all of the sex problems that are alive and thriving here in Miami, the sexiest city in America. Very sexy, but you want to keep yours. You know what's sexy? Not having a sexually transmitted disease. That's what's sexy. And as Dr. Carrasquillo said, monogamy, abstinence, those are two key components that will definitely help decrease your risk for contracting a sex problem. But also, condoms. They're easy. They're not expensive. Here in Miami, our Department of Health gives a lot out for free all over the place. You can walk into any Department of Health, even a lot of our emergency rooms, and grab yourself a handful of condoms. But when you're using condoms, it's super important to know the right lube to use and not use. For example, so many people love my Sense aromatherapy body oil because, it smells so good and ignites the greatest sense of pleasure known to mankind. But I tell people this is not a lube. It is an oil. It's a body oil. So yes, use it as a massage oil to get yourself in the mood. But if you use it on your condom, it could actually break it down. Any sort of silicone-based, and that's any oil-based type of lubricant, can actually break down condoms. So you want to make sure that you're using the right lube, like a water-based lube, when you're using a latex condom, because you want to make sure that you don't destroy the integrity of the condom. Wouldn't that stink? I had sex, I used a condom, and I still got an STD? Oh, heck no, we're not doing that.
We see that a lot. People come in because a condom broke, and they come in very scared and terrified. So absolutely right. Don't do anything risky. Oil is great. I may take a bottle home tonight, but don't use it for lubricating condoms, because that's a major problem if you do that.
Absolutely. So we have a couple of audience questions, and they need the doctor's answer. So Jeffrey wants to know, is it okay to use my friend's Viagra? I really don't want to get my own prescription, and he keeps offering it to me.
Absolutely not. See your doctor. There's a bunch of medical stuff he has to ask you, and he has to decide what's the right dose for you. Your friend may be on the highest dose of Viagra, and then you get it when you should have gotten a much lower dose, and it could create all kind of medical problems. Don't want to go there. See your doctor. Get your own prescription. No shortcuts there.
Ooh, and Sarah, she wants to have unprotected sex with her boyfriend and says, if I make him take an at-home HIV test tonight and it comes back clean, will I know for sure that I won't get infected if we have unprotected sex?
First of all, at-home tests are really good. They're not 1,000%, so you don't know. But there's many other things aside from HIV that you're also... Do you know he has herpes? No, you do not know. Do you know he has syphilis? No, you do not know that. So please, again, if you don't know, if you're not 100% sure about your partner, condoms, condoms, condoms.
Boom. And you guys know what time it is. It is time for your climax, where we give you a few points that we need you to remember about avoiding the sex problems that are here in Miami. And one, protect yourself at all costs. Prevent the problem before it happens. Don't have sex only with one person whose status that you know. Use condoms. Use some of the preventive medications that we've talked about tonight, but prevent the problem before it starts. And don't forget about the vaccines. Super important. 2, there are so many really effective therapies, both pharmaceutical that doctors can prescribe and also alternative that a lot of doctors know about. It might be over the counter and you don't even need a prescription. And 3, talk to your doctor. That is exactly how you're gonna learn more about what your options are. Be honest about what you're doing out there sexually and let them do their job and help them. Thank you so much for being with us today, Dr. Carrasquillo.
Thank you, Dr. Kenya. I mean, this is a great job you do. Thank you for being out there trying to improve the health of our community and increase awareness about these major health issues. I'm really glad people like you are doing this for us. Thank you.
Boom. For your daily dose of Nookie knowledge, check me out on all the social media platforms. That's Dr. Sonjia, DrSonjia, on TikTok, Instagram, LinkedIn. Come on, baby.